CPT 90791, the Psychiatric Diagnostic Evaluation, is the intake code that decides whether the rest of the chart holds up, and a mismatched diagnosis behind it triggers denials. When the diagnosis behind the evaluation does not match the code on the claim, you get documentation misalignment and insurance claim errors. CPT 9071, the Psychiatric Diagnostic Evaluation. Here's how operators and billers set the intake up so every later session in claim stays defensible. We cover what 90791 is, why the intake sets the tone for medical necessity, the coding pitfalls, and the documentation that protects the claim. CPT 90791 is the Psychiatric Diagnostic Evaluation, the initial assessment without medical services. It covers the intake session, the psychosocial assessment, the diagnosis, and the initial treatment plan. It does not include medication management. Use 90791 for that first evaluation. The goals, the sessions, and the claims all flow from the diagnosis you formulate here. A clinician might diagnose adjustment disorder with anxiety, but bill a generic anxiety code instead of the correct one. That error impacts treatment focus and insurance claims. Selecting a more general code that does not match the documented diagnosis is one of the most common coding pitfalls at intake. Insurers closely scrutinize whether continued therapy is medically necessary. A vague or poorly documented plan leads to insurance denials. Many EHRs list diagnoses by name, so selecting the name fills in the code. Behave Health is designed to keep the diagnosis, the 90791 claim, and the documentation aligned. When you select the diagnosis by name, the system assigns the matching code, reducing the chance of selecting an unrelated code by accident. Because EHR and billing are combined, the claim is generated with the CPT and ICD-10 codes the clinician already selected in the note. Less human error in coding. 4 factors decide whether a 90791 intake holds up, at the claim and at an audit. Let us walk through all 4. Miss any one, and you risk documentation misalignment, a denial, or a finding on audit. First, make the diagnosis in your documentation match the code on the claim. The diagnosis in the initial assessment and treatment plan must match the code billed, or you get claim errors. Double-check that the code corresponds to the documented diagnosis and not a generic anxiety or depression code selected by habit. Second, write the intake to demonstrate medical necessity. Describe clinically significant impairment in functioning, not just that the patient is upset, so the need for treatment is clear to a reviewer. Payers expect the plan to state the anticipated frequency and duration of treatment, like weekly individual therapy for a set number of weeks. Third, build measurable goals and objectives off the diagnosis you formulated. Goals should be specific, measurable, achievable, relevant, and time-bound. Vague goals like feel better are not enough. Each goal must clearly address the problem from the diagnosis, which is what demonstrates medical necessity. Fourth, keep every later progress note pointing back to the plan from the intake. Each progress note should reference which goals or objectives were addressed, showing continuity between the plan and the treatment delivered. Treatment plans should be reviewed and revised at appropriate intervals so the chart does not go stale or out of compliance. Beyond the claim, accreditation bodies look at the same intake documentation, get it right once, and both reviewers are satisfied. Joint Commission and CARF standards expect treatment plans that are individualized, goal-oriented, and regularly updated. Document that the patient collaborated in developing the plan. Surveyors look for evidence of patient participation. Anyone reviewing the chart should see the logical flow from assessment to plan to interventions, which is what makes audits go smoothly. Behave Health connects the evaluation to the plan and the claim, so the elements that make a 90791 intake defensible are captured as the work happens. Selecting the diagnosis by name assigns the matching ICD-10 code, which is designed to reduce the chance of billing an unrelated code. Goals and objectives entered on the plan can be pulled into progress notes, designed to keep every note aligned with the plan on record. Combined EHR and billing can check common billing rules and flag issues, like an attempt to bill 2 90791s for the same patient. Stop losing claims to a mismatched intake code. Book a 20-minute demo at behavehealth.com. See the evaluation, the treatment plan, and the claim connected in one record at behavehealth.com.